We're here with Dr. Peter Lovejoy with Family Tree Dental. And Dr. Lovejoy, it's interesting when we're talking with you guys and just finding out more about dental practice in the dental industry. My gosh, things have changed. A lot different than they used to be. How many years you been in the business and how much change has gone on?
Oh my gosh, I've been since 2008, so almost 20 years working on it, and a lot's changed. When we were in dental school, we learned from teachers that have been practicing for 50 years and really old school, and now they have all kinds of things, three-dimensional scanning and three-dimensional imaging. It's amazing.
You talk about the 3D imaging.
Yeah.
Yeah. It's almost like, okay, Star Wars or this futuristic idea, but it's amazing how technology has really helped you zero in on being able to get the best treatments possible. How has that helped you?
So it's helped. It's helped because I can get things done faster. The lab can, they can start working on your tooth. If we're doing a crown on you, they can start working on it before you get in the parking lot. So it's pretty amazing. Things are much more accurate. We don't have a long time where you're wearing temporary crowns or anything like that. And then you don't have a mouthful of mush. So people really enjoy just having it's like a big toothbrush. You kind of wave around your mouth and it makes little clicking sounds. And then when you're done, you're done.
Yeah. Well, listen, having to go to the dentist, there's been a lot of fear there. People worried, there's some things that prevent them from actually getting some work done, but it's even with the technology of doing a 3D scan, but also like there's been advancements in sedation and everything to help people feel comfortable when they're sitting in that chair.
Yes. Yeah. We have a lot of options that we have available to us. The simplest one is laughing gas. Everybody's familiar with laughing gas. Very common and very easy to use, very safe. Then we can step it up a little bit more. We can give you a pill that you take. You need to have a driver with you, but you take the pill and just kind of relaxes people. They describe it like having a glass of wine. And then we can go into where we put an IV in your arm, very easy to do, not hard, and give you some medicine, and we turn you what we call the Dory drugs. Dory the fish from Finding Nemo.
Yeah, nice.
So she can talk, she can swim a little bit, she doesn't remember anything. So we all love Dory.
Oh, that's yeah, we do. Implants, things have changed, like you said, in the time that you've been practicing medicine, but my gosh, implants have come a long way. And someone that is looking to question whether or not they would need one or fear of getting one, boy, there's a lot of technology that helps that more so now than it used to.
Yeah. So with the 3D imaging we have, we can actually make a little device that you wear when you have the surgery done. It holds the drill and everything, puts it in the perfect spot that we want. We pre-plan it. And then usually for most patients, they want to know a couple things. How much does it cost? How long will it take? And does it hurt? For most of my implant cases, it's usually a couple of Advil.
Huh.
So not for everybody, but certainly for most, just some Advil and they feel better. It can take, depending on the what we need to do, it can take months to sometimes as long as 8 months, just depending on the case. But we have a lot of ways to make it faster and more comfortable. And we can also drive the prices down. That's one of the things we've done here at Family Tree is try to use technology to lower our prices.
Yeah, that's interesting that you would bring that up because that's the first thing people think. They're like, well, whatever age you are, I'm just not going to worry about it. But the price can be not only affordable, but at Family Tree Dental, you guys have done an absolutely fantastic job of helping people with their insurance, with payment plans to make sure it's an affordable option for them.
Yeah. We have some front desk team that are really good and they know the business so they can help maximize your insurance benefits. We'll do some things where we might do part of the procedure in 1 year, 1 calendar year, and then wait for your insurance to renew and do the other part in the other calendar year. So we try to do some things creative to help our patients get what they need.
Something else too with talking to the team and it's Family Tree Dental. You guys are a family. Hearing from a lot of your patients, you guys treat them as if they are your family and the welcoming appreciation that your patients and the people have for you guys. It's kind of overwhelming. Why is that so important to you?
It's a small town, so you see these people in the grocery store, and it's easy for people to say, "Hey, I saw your kid at practice or at school or whatever." So you get to know each other really well, and a good reputation spreads really quickly. One of the things that I'm proud of is I know what I can do really well for people, and if there's something that someone else can do better, I'm more than happy to say, "No, you need to go see this doctor. They'll do a better job than I can for the same money."
Yeah.
So we do things really well, and we've been able to branch out and kind of develop our own expertise inside the group. And so we try to leverage that.
Well, that's the other important thing too. You guys have so many options, so many things available, and you're going to take people as if they were your family. So Dr. Lovejoy, thank you guys so much.
Oh, you're welcome.
Fantastic. And with Family Tree Dental, Dr. Peter Lovejoy.
Our dental team would love to answer your questions and provide the solutions you're looking for. Contact a Family Tree Dental near you.